topic for today is all about lactate. Lactate is a byproduct of an emergency mechanism that produces a small amount of ATP when oxygen delivery is severely diminished. Pyruvate is the normal end product of glucose metabolism called glycolysis. The conversion of pyruvate to lactate is activated when deficiency of oxygen leads to an accumulation of excess NAD. So most of the time, your cells use oxygen to break down food for energy. But if your cells can't get enough oxygen, they can switch to another process for making energy that doesn't use oxygen. This backup process makes lactate. In this picture shows the process of aerobic and anaerobic metabolism of glucose. Under this condition in aerobic metabolism, pyruvate is converted to acetyl coenzyme A, which enters the citric acid cycle and produces 88 mole of ATP for each mole of glucose oxidized. However, under hypoxic condition, acetyl coenzyme A formation does not occur and NADH accumulates, favoring the conversion of pyruvate to lactate through anaerobic metabolism. As a result, only 2 mole of ATP are produced for each mole of glucose metabolized to lactate, with the excess lactate released into the blood. This figure 16.8 is the metabolic effect of hypoxia, leading to cell death. Lactate is a byproduct of anaerobic metabolism. It is not specifically regulated as with potassium or calcium, for example. As oxygen delivery decreases below a critical level, blood lactate concentration rise rapidly and indicate tissue hypoxia earlier than does pH. Measurements of blood lactate are useful for metabolic monitoring and critically ill patients, for indicating the severity of the illness, and for objectively determining patient prognosis. There are two types of lactic acidosis, type A and type B. Type A Type A is associated with hypoxic condition such as shock, myocardial infarction, severe CHF, pulmonary edema, or severe blood loss. While the type B is of metabolic origin such as with diabetes mellitus, severe infarction, leukemia, liver or renal disease, and toxins like ethanol, methanol, or salicylate poisoning. Specimen handling. Special care should be practiced when collecting and handling specimen for lactate analysis. Ideally, a tourniquet should not be used because venous statis will increase lactate levels. If a tourniquet is used, blood should be collected immediately and the patient should not exercise the hand before or during collection. After sample collection, glucose is converted to lactose by way of anaerobic glycolysis and should be fermented. Heparinized blood may be used but must be delivered on ice, and the plasma must be quickly separated. Iodoacetate and fluoride, which inhibit glycolysis without affecting coagulation, are usually satisfactory additives, but the specific method directions must be consulted. Under method, although lactate is a sensitive indicator of inadequate tissue oxygenation, the use of blood lactate measurement has been hindered because older methods were slow and laborious. Other means of following perfusion or oxygenation have been used, such as indwelling catheters that measures blood flow, pulse oximeters, base excess determinations, and measurements of oxygen consumptions. Current enzymatic methods make lactate determination readily available. So, the most commonly used enzymatic method use lactate oxidase to produce pyruvate in H2O2. Lactate plus O2 is converted to pyruvate plus H2O2. One of the two couple reactions may then be used. Peroxidase may be used to produce a colored chromogen from H2O2. In this table is the reference ranges for lactate. So, under enzymatic method plasma, venous 0.5 to 2.2 millimole per liter, arterial 0.5 to 1.6 millimole per liter, cerebrospinal fluid 1.0 to 2.9 millimole per liter. While in colorimetric whole blood, the venous is 0.9 to 1.7 millimole per liter, arterial is less than 1.3 millimole per liter. Cerebrospinal fluid is less than 11.7 milligrams per deciliter. And that's all. Thank you.